what are exudates? Now, simply put, exudates are protein-rich transudate. Remember, in the previous video, we just said that transudate is the ultrafiltrate of your blood plasma, and it is not typical of inflammation. So, exudates are protein-rich transudate. Now, we can also define exudate as the extravascular fluid that has two major things. It has a high level of protein content, and it also has cellular debris. We're going to talk about where the cellular debris are coming from, and then we're also going to talk about a few protein contents that we can find in our transudate. Now, the next thing we have to remember is that it is a typical situation in inflammation. It is a typical situation when your vascularized tissues are responding to infections, they are responding to microbes, they are responding to necrotic tissues, or just unharmful stimuli like allergens. You can see a situation of exudate occurring in inflammation. The last thing is that what is the site? Now remember, when we talked about transudate, we were more so saying it was occurring in the capillaries. Why? Because at the capillaries we have an increment in exchange. We have gas exchange, nutrient exchange occurring at the capillaries. And so when there is an increased hydrostatic pressure, we have a lot of fluid escaping from these capillaries into the interstitium. But then in the case of exudate, it usually occurs at the post-capillary venules. Now, the post-capillary venules, as the name goes, it's just after the capillaries, but it is so instrumental for inflammation because it just has an endothelial layer and it is simply followed by very few smooth muscles, and so it can easily seep out and cause for a lot of movement of fluids, proteins through their cells during the concept of exudate. Okay, so we're going to be looking at the concept of exudate, and we're going to explain a few things about what happens during exudate. Now, we know that during inflammation, there are microbes or say necrotic cells that releases certain stimuli to your blood vessels. Now, we call these stimuli in terms of cytokines, they can be amines, and so on and so forth. Now, the result of these stimuli come to your blood vessels and they begin to stimulate for increased vascular permeability, right? So, increased vascular permeability occurs and your vessels start to become permeable. The permeability of your vessels allow for seeping out of fluids. Fluids begin to seep out. And alongside with these fluids, the protein within the blood also begins to seep out. And eventually there is going to be a lot of cells within your vessels. Now, a high amount of cells within your vessels is known as vascular congestion because the red blood cells are the highest amount occurring mostly in your vessels. And so when they are plenty in the vessels, vascular congestion occurs and they start to push your neutrophils to the base of your vessels so that the next process of recruitment of leukocytes can occur through a process called diapedesis. But before we go to all those theories of inflammation, we have to focus on exudate. Now, for exudate, we said these are protein-rich contents. What do we mean by protein-rich content? In your blood, you're going to find cells and you're going to find plasma. Within your cells, you're going to find basically your red blood cells, your white blood cells, your platelets. However, within your plasma, you're going to find proteins. Now, if we want to expatiate on these proteins, we have different types of proteins occurring in your blood. We have, so I'm going to write it here for clarity's sake, proteins in your blood. We have albumins occurring in your blood. We have fibrinogens occurring in your blood. And we have globulins occurring in your blood. Interestingly, for our globulins, we have alpha-1 globulins, of which we can see the alpha-1 antitrypsins. We have alpha-2 globulins, of which we can see your alpha-2 macroglobin. We have your beta globulins, and we have your gamma globulins. Okay, I'm going to clean this. Now, Basically, for your gamma globulins, you're going to see your immunoglobulins in the full class. We have G, we have A, we have M, we have E, we have D. And for your beta globulins, we are going to see stuffs like plasminogens. Alright, so plasminogens was in the class of the beta globulins. Now, when we said exudate, we said these are protein-rich transudate. So it means that a lot of proteins, it could have albumin, fibrinogens, globulin within these extravascular fluids. And then another thing we have to remember is that not only are we seeing proteins, but we are also seeing cellular debris. Now, these cellular debris can be occurring as a result of either the microbes that stimulated the inflammation. So the microbes come to the site and then they start to destroy cells. So destroying cells, giving us what? Cellular debris. Or we could also remember that necrotic tissues could also cause for inflammation. And so cellular debris, proteins are typical features we are going to see in the concept of the exudate. Now remember, when we looked at the transudate, we said transudate is going to have a very low specific gravity. When we talk about specific gravity, we are saying that what is the gravity of a substance in relation to water. So density of a substance in relation to the density of water. And so in the concept of transudate, we saw that low specific density because these are not protein-rich fluids. They are almost like water, so to speak. And so we're going to have low ones. But then in the concept of exudate, which are high protein-rich fluid, we're going to have a relatively high specific gravity occurring here. Now, finally, remember again that it is going to be occurring in the post-capillary venues. That is the site of inflammation occurrence in our vessels, and we're going to see a lot of permeability occurring. Remember, for permeability to occur, for your vessels to be easily permeable, we can see substances like our amines, which comes to the venues. Example of our amines, we have histamine, we have even serotonin, which is a very important amine, and we also have our arachidonic acid metabolite. So example of some arachidonic acid metabolites will be things like our leukotrienes, we could have things like our prostaglandins, and we could eventually have things like our thromboxanes. These are all metabolites, but mostly our leukotrienes, our prostaglandins will be keenly involved in causing for increased vascular permeability and also for vasodilation, thereby enabling the process of inflammation. Okay, so the final two we're going to talk about today is edema and pulse. What is edema? Simply put, edema is the accumulation of fluids within the interstitium or serous cavities. Now, what is the interstitium? Interestingly, we should remember that our cell has a cell-to-cell connections between themselves, right? So within cells, you see the presence of junctions that occurs between them. Now, when you have your capillaries delivering blood to these cells or delivering nutrients to these cells, so we call these our capillaries, and then there is the process of gas exchange to these cells. Now, because your cells are connected one to another, they are also suspended within a net of connective tissues, and also some connective tissues can occur between these cells. And we call these connective tissues in which our cells are suspended in, we typically call them our interstitium. So, what do we mean by collection of fluid within the interstitium or serous cavities? When this fluid escapes from either the capillaries or the post-capillary venues into the interstitium, which is just simply put the environment surrounding your cells, and they accumulate there, we call that concept edema. So edema can either be transudate or it can either be exudate. Very important. And so you can see something like someone said, oh, there's a pulmonary edema occurring in this patient, or a more common one is our peripheral edema. So I'll write it first. We have pulmonary edemas, we have peripheral edemas, which can also be expressed in form of our subcutaneous edemas. Very interesting for us to remember. Now, what is your pulse? Simply put, that pulse are purulent exudates. So, what do we say exudates are? We said that exudate is our protein-rich fluid or protein-rich transudate, right? And so, if our pulse are purulent exudate, what can we find in our pulse? In a pulse, you can find inflammatory cells, precisely your leukocytes. So, inflammatory cells or inflammatory leukocytes, precisely neutrophils. You can find dead cells. And finally, you can find, in most cases, microbes. You know, microbes act on substances and go through a process of putrefaction, and that is what is the accumulation of most cause occurring. And so you could see that if a body is being buried over time, the flesh will be separated from the skeleton, because microbes will act on the flesh and undergo the process of putrefaction and remove that body from the bones over time. So these microbes are instrumental in pulse formation. Now, finally, we have to give the concept of abscess. What are abscess? Abscess is simply a collection of holes. Thank you for sticking around for today's video. Watch out for much more video, and I'll see you later. Bye.